Do you truly have sciatica? And if so, what even is it? Dr. Nicholas Mercer with uImproved PT. A lot of people ask me about their sciatica and they say, hey, I have sciatica. What exercises, what can I do to help make my sciatica better? And my answer is always, it depends. Here's the reason why. Sciatica is more of a diagnosis of symptoms. What do I mean by that? Sciatica is basically pain stemming from the sciatic nerve somewhere. That can be down through the back of your hip. It could be kind of up through the SI joint area. It can be down the back of your leg, down into your calf, even into the foot, causing some numbness and tingling. If you don't have symptoms in that sciatic distribution, you may have nerve pain, you may have some neurological issues, but you don't have sciatica. And even then, there's so many different things that can cause sciatica. I'll just name a few. Herniated discs, spondylosis, spondylolisthesis, stenosis, arthritis, Piriformis syndrome. The list goes on. Not indefinitely, but there are a lot of different things that can cause sciatica. And so I hesitate to tell anyone this one thing is going to fix your sciatica because, again, it's a symptom. That's like saying, I have back pain, what can I do to fix it? Well, what's causing your back pain? What kind of back pain are you having? Where specifically is the back pain? It's not that easy. So there's no one movement that is going to just fix your sciatica because, again, a bunch of different things can cause it. However, in a lot of my patients, there's one stretch that gives them a little bit of relief. It may not be long-lasting, it may not be permanent, but it's relief nonetheless. And that is actually a piriformis stretch. So what's really interesting about the piriformis is a few things. First of all, for some people, that piriformis, so it connects from the sacrum down to the femur here. For some people, if we have that muscle, the nerve, the sciatic nerve, actually goes through it. Now, this is only in a certain percentage of people, but even if you're not that percentage of people, then the sciatic nerve will go under, and if we have restrictions in the piriformis that is causing it to not want to lengthen and allow that sciatic nerve to glide very well, if it's pressing on the sciatic nerve, it can cause a lot of symptoms. Why does the piriformis get restricted? Why does it get dysfunctional? One of the reasons is because it does a whole heck of a lot, and it does a lot depending on how you're positioned. So the piriformis will externally rotate the hip if the hip is lower than 90 degrees. So piriformis is working all the way up to 90 degrees. Once we hit 90 degrees of hip flexion, it does the opposite. It starts to turn it out. Now that gets really complicated into how the piriformis is connected into the femur. Probably not interested in that, but just know that piriformis has to switch its action completely, take a 180 to what its action is when we bring the hip above 90 degrees. So it has a lot of demand placed on it, and it loves to compensate. And we can get a lot of restrictions in that piriformis because of this, and then that can press on the sciatic nerve, cause sciatica. However, even if that's not where our sciatica is stemming from, and this is very interesting, a lot of patients who I've seen personally have had sciatica associated with back pain, and we've kind of determined through some other tests that, yeah, the back is actually where we're getting a lot of that irritation, and we're just feeling it down the leg here, whether that's from a herniated disc or any of the other myriad of things I said. That piriformis stretch still helps them. And why is that? Well, that's because we're not just stretching the piriformis. So sometimes the piriformis stretch, and the one that I'm going to show you, will actually help stretch the glute max a little bit. And if the glute max is restricted, it's going to be holding us a little more in flexion here. And so we may have some restrictions there, causing the lower back to irritate the sciatic nerve even more. So even though I'm calling it a piriformis stretch, a lot of people will find some relief from this exercise I'm about to show you due to a number of different factors, right? We may be stretching the piriformis, that may be helping with your sciatica. We may be decreasing some of the restrictions in some of the hip extensors or some of the muscles that are responsible for pulling you into posterior pelvic tilt, and that is causing the sciatic nerve to not be irritated as much in your lower back. We could even be decreasing the pull of the piriformis on the sacrum, and that is causing your anterior pelvic tilt. By stretching the piriformis, we're not alleviating that pressure in the piriformis on the sciatic nerve, but we're alleviating any pressure from that sciatica in the pelvis. I know, a lot of different things that can go on. Don't worry too much about that. What you need to know is, if you have sciatica, for a lot of people, this helps them a little bit. It is not a magic bullet. It's not going to fix your sciatica, but it can give you some relief. If it irritates it, don't do the stretch. If you do feel some relief, throw the stretch in throughout your day. Okay, this stretch is very simple. You've probably seen me show it to you before. But what we're gonna do is lie on your back. We're gonna cross one leg over, and there's a couple different ways we can do this, and what you really wanna do is find the angle where you feel most of the stretch through your booty here, okay? So first way we can do it, grab that knee and pull closer to your chest. Again, you should feel this stretching you in the booty right here. Now what are we stretching? Do we feel that in the piriformis? Do we feel that in the glute max? They're kind of in the same area, so you may be getting a little bit of both. That's fine. Just hang out here, hold for about 30 seconds to a minute, and do that a few times. And even if you're only getting sciatica on one side, try it on both sides. It won't hurt. Now, if this bothers your hip or this increases your sciatica, just lower it and pull that knee to the opposite shoulder. Just like that. Okay, you may feel this stretch a little differently, but what we're really looking for is an alleviation in sciatic symptoms and a stretch in the booty right here. Again, hold 30 seconds to a minute. So if you found relief from this, throw that in throughout your day. If it actually irritated your symptoms, don't do it. Something else may be going on in there and you need to get that checked out by a physician. So again, there are no magic bullets, but this may help you. If you'd like more information on ending back pain, ending sciatica, please go to uImprovedpt.com. We have a lot of free information on ending various different types of pain, but also check out the rest of the uImproved PT YouTube channel, where we're posting 3 videos a week on various different topics. One of the major ones is lower back pain and sciatica. So if you subscribe to that, you will see those as they get released. Follow us on all the social media things. You can check out the Linktree link in the description below. That'll take you to all the different social medias we're on for more free information on alleviating your pain. And please, just get ready to move more, pain less.